Andina wirine munuasi uzitara Jesu dinomira kuna Jesu diye dombo dichayuraza kuti ali wangeli matsitsi zake nogarira imomo umepo yesimbaru okorwa wake inindobata dinomira kuna Jesu ndiye dombo neyo yangu chene ndichanyuraza kuchirangano chake ichonde chitsezo chero karo zinondipa iroro simbiro pakati pematambudzo yene ndinomira ikona Jesu ndiye dombo neyo yene ndinganyuraza ipo apo eyanenge oyandetsuri chazorizwa ene ndinona kuti ndimerena Jesu ipo pano chiwake ene ndinomeraho na Jesu ndiye dombo yeneyo yangu chene ndechanyuraza ndinomira ikona Jesu ndiye dombo yeneyo yangu zimwe chanyuraza.
And then I started to search heaven, but I didn't see you. And then I saw Mother, and I asked about you, but she hadn't seen you. I dreamt I saw Father, and I asked about you. And then we started to search heaven, but we didn't see you. And then I saw Jesus, and I asked about you, and then he took me by my hand, and he led me to that bed. And then I saw you there, and I thanked him. I found you. And then I saw Jesus, and I asked about you. And then he took me by my hand, and he led me to that to stand before the throne. On Christ the solid rock I stand. All other ground is sinking sand. All other ground is sinking sand. On Christ the solid rock I stand. All other ground is sinking sand. All other ground is sinking sand.
The COVID-19 pandemic has disrupted people's lives, bringing with it anxiety, fear, lots of distress. I'm excited to be sharing with you tips on mental health, insights on mental health, and what I've done is to compile a list of frequently asked questions in mental health so that we can share and see how we can survive and be emotionally well in these times. So we need to put this into context a little bit. What is health? The WHO, World Health Organization, defines health as a state of complete physical, mental, and social well-being. So what it means is that you need to be physically fit, you need to be mentally well, and also you need to be socially well-connected. So health is not just the absence of disease. It includes these three components. And since we are including mental health, it means there is no health without mental health. What is mental health? So again, the World Health Organization defines mental health as a state of well-being in which an individual is able to realize his or her own abilities, okay? Should be able to cope with normal stresses, should be able to work productively and fruitfully, and should be able to make a meaningful contribution to the society. So please note that mental health does not necessarily mean that there is the absence of pain or that there is no problem. So we will have problems, but we should be able to rise above those problems and cope with those problems, okay? So the first question is, what are some of the mental health challenges that are found in our community? So one of the biggest challenges that is there is stigma. So this is how people have myths and misconceptions concerning mental health, which hinders them from getting help that is required, or even just identifying mental health issues or problems and being able to take care of those. What are some of the myths and misconceptions? So people think of mental health in many ways. There are some people who think as Christians we are immune to mental health problems. We will talk about a lot of a number of biblical examples, people who are spiritually very strong, very well connected to God, who suffered from mental health problems. So some people think, no, it's attention seeking, no, it's a white people's problem, or if it's our problem, maybe it's ngozi, avenging spirits, maybe there's something that these people did, or maybe it's caused by demons and therefore we can pray it out and cast out the demons. Some people think mental health has got to do with witchcraft, or maybe the person was abusing drugs, or it's just weakness. Strong people don't get emotionally distressed. Then we have also other people who acknowledge mental health issues but think that it's not treatable. Therefore, they can't get proper help for that. There are some people who think everyone with mental health issues is dangerous, and in a few cases, like epileptic seizures, for example, seizures not just through epilepsy, because they can come in many other ways. Some people think, this is disgraceful, and therefore they want to hide it and they don't want to talk about it. Then we have some people who think, mental health should be a punishment from the devil. So you see, what we believe about mental health determines where and how we get help, okay? What do you do with a broken leg? It's very clear. If someone breaks a leg and we are seeing bone and blood there, we know what to do. We know how to rush for emergency help so that the person can be treated, put metal pins, antibiotics, pain medication. We know that very clearly. But do we know what to do with a broken heart? Do we know what to do with broken emotions? So what we believe about the causes of broken emotions, broken hearts, and how it determines where we should go. So why is this important for us as Christians? Because we need to go out there and help. What is our role? What can we do? This is what we can do. We need to have an appreciation of mental health problems, what they are caused by and stuff, so that we can go out there and help others appropriately, okay? So we can be our brother's keeper by just being equipped with this knowledge. So I'm really happy that we can be sharing these insights during this program, and we live an empowered people who can go out there and be ambassadors as Christians, right? Next question, how do we know that this is a mental health problem? When can you tell that this is spiritual, or this is maybe this is just normal behavior, or it's a mental health problem? There is an easy way. There are several ways of doing it. I'm going to share with you one of the simple ways of knowing whether something is now a disorder or not. And we use what we call the 4 Ds, okay? So the first D is deviance. What does this mean? You notice that behaviors occur on a continuum, okay? If we are happy, you know, like it's got levels of being happy. And we expect that there is a normal range of happiness. If we are sad, there is a normal range of sadness, and also depending on what we are sad about, what we are happy about, it should fall within what we call a normal range. A lot of you will be familiar with the bell shape of normalcy for characteristics. So, for example, we expect very few people to wear size 3, 2, 3, 4 shoe size. And we expect more people to wear size 4, 5, 6, 7, 8, 9, 10, 11. We expect fewer people, 12, 13, very few, okay? So that's our normal range of characteristics, whether it be behaviors, emotions, thoughts. So if something becomes deviant, it's falling out of the normal bell shape. Either it's too much or it's too little. Then we say that deviancy is abnormal, okay? So for example, a person might become excessively talkative, so talkative that they have time to eat, they can't even sleep, it becomes a problem. Or they become so excited, so happy, and it's inappropriate. Or they become so sad that they can't get out of bed, they can't eat, they can't speak to anyone, they become withdrawn. So that deviant behavior is what we call abnormal behavior. So you'll find that mental illness can actually occur on things that are common, like fasting and preaching. If you then find someone maybe knocking on everyone's door, maybe at 2 a.m. because they want to preach, they are not caring about anything else, they are not, not even taking care of family, or they are fasting and forcing everyone, including babies, to fast because, they've had some insight. That behavior is deviant and there is a problem. Or excessive fear, withdrawal from people, or being disinhibited, doing things that are not appropriate at appropriate times. Okay? So deviance is one of the ways that we can tell that there is a problem. Then the other D is dysfunction. When a person is not well mentally or emotional, they will not be functional. So you might actually find people arguing that they are okay. I often find this with people who are abusing substances, arguing that they are okay, maybe their family members are the ones with problems. But what we notice is that if someone has a mental problem, they become dysfunctional, which is demonstrated by maybe poor self-care. They don't care how they look, they don't care how they relate to others, problems with keeping jobs, problems with relationships with family. So if you do a group session with people who are abusing substances, for example, you'll find that out of maybe 20 people, almost all of them will have problems with relationships, never married, divorced, single, never had children, have one child, but she went with the mother, never kept a job, didn't collect my results, didn't complete. The longest they might stay at a job is 6 months. So those are some of the things, telltale signs that might tell us, I think our colleague or family member is having problems, so dysfunction. The third D is distress, okay? Most mental health problems come with distress. So for example, a person might actually begin to experience unpleasant and upsetting things like auditory hallucinations, or visual hallucinations, seeing or hearing things that are not there. This is actually a very severe form of mental illness, and if this happens, it's a red flag. You need to get urgent attention. Sleep problems, difficulties fitting in society. So this has got to do with esteem issues, and in its severity, you actually find that a person cannot fit in their family, with colleagues, at work. That's a problem. So distress comes with a lot of stress symptoms, for example, extreme moods, loss of appetite, weight changes, and generally being unable to cope with everyday lives. Then the last D is danger. Usually when a person, in its extreme forms again, a person becomes a danger either to themselves, wanting to commit suicide. And I often hear people arguing when they have attempted or are suicidal, they argue that they are okay, they don't think it's a mental illness. Hello, when you are a danger to yourself, that's a sign that things are not well and you need to get help. And or when someone becomes a danger to others, this comes in different ways, a danger to others or even a danger to property, wanting to hurt others, that's a problem. The next question is, are these mental health problems common at all? How common are mental health problems? Sadly, mental health problems are common worldwide. For example, 1 in 4 adults experiences a mental health disorder in a given year. 1 in 4, that's huge, okay? Then about 1 in 17 lives, 1 in 17 people lives with a mental illness, okay? 26% of people who are homeless live with serious mental illnesses. And I'm quite sure you've seen our relatives, friends loitering on the streets, whether it's cold or what, you might find them on the highway, walking barefooted, right? Do we have mental health problems amongst children? Yes, sadly so. 1 in 10 children and the youth experience a mental health disorder. About 20 to 25% of people who are in jail, so the inmates, they actually have some kind of mental health disorder which might have made them get them incarcerated, or which might come because of the incarceration, right? One alarming fact is that we lose 1 life to suicide almost every 15 minutes. A person is dying worldwide out of suicide. So that's huge. Nearly 5 to 10% of people in communities at any given time need help for depression. So depression is actually one of the most common mental health conditions, and I'm going to talk a little bit more about that. 8 to 20% of people carry the risk of developing depression during their lifetime. And the average onset of depression is between the ages of 20 to 40 years. But we can have people earlier than that or later than that succumbing to depression. Then another sad fact is that women are twice more likely to suffer from depression. The depression prevalence for women is 24% and for men it's 12%, right? Another thing that I hope we'll be aware of is that 30%, almost a third of people with chronic illnesses will succumb to depression. So you might be well, you might be, but when you succumb to a chronic illness, whether it be cancer, HIV, or stroke, you are likely to suffer from depression. And what's worse, it doesn't end with the person with the chronic illness. Caregivers also get depressed when they are taking care of a relative with a chronic illness. Lately, we've been seeing a lot of caregivers who actually become dysfunctional, have problems going for work, have problems functioning because they are taking care of maybe a parent or a spouse with a severe chronic illness. Things like stroke, you have to lift your relative, and especially if the person is severely unwell. That is very distressful, and family members, especially the primary caregiver, is likely to become depressed. So I hope that we become alert to these issues and we give as much support as we can, not only to the person who is going through a chronic illness, but also supporting relatives. One of the things, just in passing, that I might share is that if a person is taking care, if you are the primary caregiver of someone with a severe chronic illness, you need to take a break. You need support from others and take occasional breaks so that you can recuperate and come back a better caregiver. I know that a lot of people don't understand and they feel like they are letting down their relative who is unwell, but that is critical. You too need to take a rest, okay? So what is the impact of mental health conditions? So mental illness is, when we talk about the burden of mental illness, we are looking at what is the cost on the condition, how does it affect work, what are some of the losses that the nation incurs, what are the medical costs, what is the financial loss. 6 out of 10 leading disease burdened by illness, we find that mental illness is actually, it falls in the 6 out of 10 common diseases that give a huge burden in the healthcare sector, okay? So we are talking about conditions such as, so I'm mentioning these conditions because they are associated with mental illness. HIV, for example, then we've got your usual depression or bipolar affective disorder. Then some of the things that affect road traffic accidents, TB, alcohol use disorders, self-inflicted injuries like your depression. So you find that we've got 6. Mental illness actually falls in the top 10 of disease burden. All right. Then the common question that comes is, what causes mental illness? What is the cause? Because knowing this helps us to know how to treat it. I want to start by saying no one is immune to emotional disorders. I mentioned earlier that chronic illness can actually make you prone to, so chronic illness either on you or on a caregiver. Who can say they are immune to that? None of us, okay? So mental illness knows no age, it knows no race, no nation, no financial status, no religion even, okay? And what I want to say is that there is no one cause of mental illness. It's actually a lot of factors combined together. You will see as we go. So that's why I like to use what we call the biopsychosocial model to explain mental illness. It's not just one thing, it's a lot of things going together. So for example, if you see someone with an extreme temper, severe anger issues, don't just judge the person by the anger that you are seeing. We say that the anger is just the tip of an iceberg. There is a lot more going down there. Maybe this person was hurt before, maybe this person was rejected, humiliated, frustrated. There's a lot of things that are going on in their life, and that anger is just a symptom of the many things that are going on. So what are some of the causes on the biopsychosocial model? Let's start with the biology. Did you know that there are biological factors that predispose a person to mental illness, whether other things are going well or not? So we are talking about our genes. There's evidence from identical twin studies which show that if a person is suffering from depression, for example, one twin, even if they are separated, there are 60% chances that the other twin will also have mental health issues, okay? Our family trees, you notice that there are certain things that run in the family, like suicide, depression, those things run in the family, chemical imbalances, brain damage, for example, or even conditions before a person is born. If a mother becomes unwell or their nutrition is not the best, or when a person is being born at birth, if they get assisted by forceps, for example, and their head is, squashed. When a baby is born, the skull is still not as hard. That might actually predispose someone to mental illness. Okay, there is evidence that if a first-degree relative has a mental health condition, there are 50% chances that you might actually have it. If it's a second-degree relative, say a niece or a nephew, there are 25% chances that you might have it. If you are not related, you are not likely to get it. Some people say, I don't want to work with people with mental illness because then I might become like them. No, it doesn't come like that. But genetics makes you predisposed. The challenge is that when people see in one family, maybe someone attempted suicide, someone is depressed, someone is having mental health issues, they'll start thinking, this family must have done something. Maybe it's avenging spirits, but guess what? It's just, it can be a genetic problem. The way people have in the same family might wear glasses, in the same family might be vulnerable to asthma, in one family we might have a number of people who are vulnerable to diabetes, for example. Okay, then there are other predisposing factors like psychosocial stressors. So things like family conflict, divorce. And let me talk a little bit about family conflict. I find that children are affected severely when parents fight. Parental fighting or even divorce. So parental fighting affects a lot of people. We find children coming in with panic disorders or so physiological problems, but that have no physiological base. So they will present with many things that are not physiological because of what they are going through at home. And I want to highlight this too. There are a lot of people who go through abusive relationships, maybe shouting, beating, and they in their defense, they say they are doing it for the children. But guess what? You might actually be doing more harm to the child, exposing them to that violence. I noticed that particularly young, not young, but male children are severely affected when they cannot protect their mother when they are going through abuse. So let's watch out what we are exposing our children to, because we might actually just be breeding more and more distress in the family. Okay, other things. So these are predisposing factors which make a person vulnerable. Then there is what we call precipitating factors, what might actually then trigger the illness. It could be something that happens, big or small, or it can be cumulative things together. So an unfavorable life event or negative life events, deaths, losses, divorce. When I talk about loss, we are talking about loss through death, but also loss through different things like maybe loss of a body part, loss of health, loss of relationships, and this is very common in adolescents. Relationships are very critical for them, and they might just want to die because people don't want to play with me, or my best friend left me, or this relationship didn't work out. It's things that appear small to us, but they are big depending on one's level in life. Financial losses, time pressures, problems, conflict. These days we are seeing a lot of mental health issues, people presenting with different things. COVID-related distresses bring out other things. So I want to highlight that it could be one huge thing or many huge things, or it could be many small things which happen at the same time. Those may actually then just precipitate, may trigger the surfacing of a mental health problem, especially if the person is predisposed already, how maybe biologically, or they have experienced traumas before, maybe childhood traumas, that then makes them vulnerable. Okay, Then there's what we call perpetuating factors. What are these? What keeps the problems there? Usually, maybe the problem has not been dealt with. And I urge people to make sure that they deal with mental health issues seriously. Because if you don't, the mental health problem might calm down for a short while, but it will surface usually when something else happens later in future. So it's important that we deal with it appropriately. For example, if a person becomes severely depressed, if a person suffers from a major depressive disorder and they don't get appropriate treatment, they are likely to become 50% chances are that when something happens, they will become depressed. And if that's not properly treated, if something happens, 75% chances. That's how it does, because your threshold, your strength of resilience becomes broken each time you have an episode. So it's important that we seek appropriate treatment. And with what is going on besides COVID, there are a lot of other issues going on in our country, going on in the region, the looting in South Africa, and many other problems that we are facing. We are at risk for maybe problems either accumulating or just coming. Fortunately, we've got the third P, which is protective factors. If a person has a supportive family, strong psychosocial support either from family, from church, from the environment, they are likely to thrive very well and be able to bounce back when they have problems. Then there are personal factors. There are people who are resilient either naturally or they have developed resilience because of successfully overcoming certain problems. That is helpful. Resources are helpful. Good physical health is good, and also education is helpful, and just a personality that is optimistic, all those things are helpful. Another protective factor is insight, knowing what's happening to you and how it's affecting you. That is very important. Okay. The other question is, who is at risk for developing? I spoke about general mental health issues before. Who is at risk for developing depression? Women are at a greater risk. People who are separated, who are divorced, people with a family member who is suffering from depression or who has a history of depression, early parental losses, negative or stressful life events, lack of social support, and the kind of family that a person is living into. So you will see that these are factors that we are relatively in control of. Let's try to control what we can. Then the other question that we often get in church is, are Christians immune to, or can Christians suffer from mental health conditions? Let's take a look together so that we see. I want to acknowledge that faith is a protective factor. So people who have a strong relationship with God, it's a protective factor. It's not an immune factor, okay? So more like when a relative is unwell, if you've got resources, they can help you to support that person, but it doesn't mean that the person becomes immune to death, okay? Let's look at some examples in the Bible. Job 30 verse 16, we hear Job saying, "And now my life ebbs away, days of suffering grip me, night pierces my bone, my gnawing pains never rest." Some of you might remember Elijah, who was very successful in dealing with false prophets and showing off, making fire come from heaven. But we know that just after that episode, 1 Kings 19 verse 4 says, while Elijah went a day's journey into these thoughts, to think that life is not worth living. Let's not be judgmental, especially because we never experience what the other person is going through. If these strong Christians who spoke to God directly had problems and felt that it was better to end their lives, what more people who are living in these days, right? We also know that in Matthew 26 verse 38, Jesus said to them, "My soul is overwhelmed with sorrow to the point of death." And we do know that at some point even Jesus cried, okay? What does this mean? What it means is, do we have people who have challenges in life, in church these days? Yes, we do. A study that was done at Baylor University showed that while family members with a member who has mental illness have less involvement in faith practices, they would like their congregation to provide assistance with those issues. So what we are saying is there are a lot of family church people who actually suffer problems, and they would benefit from support from us as a church. Unfortunately, usually people in church don't want to be identified because they think about mental illness as maybe something that's not Christian. It's unfortunate because then we lack an opportunity to serve our members when they need us most. Okay, so you will see that if someone gets a cancer diagnosis, people will invest in treatment. They will mobilize money for tests, for medication, for care. They will visit the person in hospital. They will send notes and cards and flowers and fruit. You know, they will pray for that person and support the whole treatment and talk about it and welcome the person when the person is back at home. But when a person suffers from mental illness, not much investment is done. I often hear family members refusing to pay for therapy for someone who's struggling with substance abuse. And yet we know that when the person engages in substance abuse, usually to self-medicate because of traumas that they are going through or challenges that they have not been able to appropriately deal with, when they start, they are in control. But after that, they are not in control and they need our support to help them. So we should not throw them away, but we should invest hospital visits, support, treatment support, the way we treat other health conditions, and not look at it as wasting money, but look at it as support. Okay? So what can we do as a church? We can help through giving education, giving support, reaching out and being there for people who need that kind of support. All right? Just to conclude, the Seventh-day Adventist Church has known about mental health conditions. Ellen White said in one of her books, "The condition of the mind has a much greater impact than it is generally believed. Many illnesses are as a result of depression, sorrow, anxiety, frustration, remorse, guilt, and difficulties with trust. Difficulties with trust undermine vital forces and result in dismay and even death." So mental health issues are a life and death matter. Okay. Lastly, can mental health problems be treated? Yes, they can be treated, and they need to be treated appropriately. In some cases, remember we mentioned the biological causes. In some cases, they might need medication. There are a lot of lies that go out there that you become addicted, you become this. I find that people challenge and want to read a lot about mental health medications, but we take cough syrup, we take headache medication without questioning the impact. Yet we know that all medication has side effects. So same applies to mental health medication. So it's not that you be addicted. It is important. And anyway, it's not all mental health problems that require treatment with medication, even though there are some that may require. So what can we do with mental health problems? Let's get appropriate help. Even Jesus sought help. So you don't need to be strong. You can get appropriate help. No need to be strong. Let's go out there, help others who we see are in trouble, and if we need help ourselves, let's get it.
Be thou my vision, O Lord of my heart.
Naught be all else to me, save that thou art. Thou art my best thought by day or by night.
Waking or sleeping,
and thou my true word.
I ever with thee, and thou with me, Lord. Thou my great Father, I thy true Son. Thou in me dwelling, and I with thee riches I need not, no man's empty praise. Thou mine inheritance, now and always. Thou and thou only, first in my heart. High King of heaven, my treasure thou art. High King of heaven, my victory won. May I reach heaven's joys, O bright heaven's star. Heart of my own heart, whatever befalls, still be my vision, O ruler of all. Still be my vision, O ruler of all. Still be my vision, O ruler of all.
Hope is built on nothing less than Jesus' blood and righteousness. I dare not trust the sweetest frame, but wholly lean on Jesus' name. On Christ the solid rock I stand. All other ground is sinking sand. All other ground is sinking sand. When darkness seems to veil His face, I rest on His unchanging grace. In every high and stormy gale, my anchor holds me in the veil. On Christ the solid rock I stand. All other ground is sinking sand. All other ground is sinking sand. His oath is covenant and blood support me in the whelming flood. When all around my soul gives way, He then is all my hope and stay. On Christ the solid rock I stand. All other ground is sinking song.